Hey Boston, I'm Melissa Hector, your host of Boston in Common, your local health equity broadcast show. And we're here today on another segment of maternal and infant health with our own Lisa White. Lisa serves as a public health advocate, a licensed community health worker, and a doula with the Boston Public Health Commission. Lisa, we're so excited and honored to have you here today with us.
Thank you. I feel honored and privileged to be here.
I would love for you to just shine a light on what brought you to this position, what brought you to this point, how long you've been serving with the city in this capacity.
So I've been here 18 years as of the 2nd of February 2024. And the reason I came into this work is because it's always been my passion from a young girl. Growing up in the Caribbean, I was considered the Caribbean babysitter in my country because my area where I lived, anybody who had a baby, I was always there trying to pick that baby up. When the baby was old enough and could go for walks, I would be the one taking them for walks and doing all of that. So I always had that type of maternal thing, loving children. I mean, I love people on a whole. I'm a people's person, but for some reason, children are just part of my existence from a young girl. And not that we had many people in our family. I'm a family of 4. I am a twin. I have 2 younger brothers, but we are very close in age. So we never really had to take care of each other. But as I said, when persons were having children in the neighborhood, I would always be around wanting to change we had diapers, people with pins, and you had to wash the diapers out. So it wasn't all that fancy baby pampers that we have now. I wouldn't even mind washing it, and just to be around the baby, it was just something I enjoyed. It's something that just stuck with me and probably will remain with me for the rest of my life. When I came upon the opportunity, I was in between jobs, and one of the colleagues here, Mrs. Shirley Shillingford, I was volunteering with her. We do have a food pantry with the Boston Public Health Commission that she runs. Position became available 18 years ago. And she's like, do you want a job? And I'm like, of course, I'd like a full-time job because I was doing a part-time job at the time. And she's like, well, there's a position open. Do you think you want to go try? I said, okay, nothing beats a trial, but a failure, and I came in and I did the interview. And it was a round table interview. I was hired, and I'm here today, still working hard.
Wow. It takes a lot of work, and it really takes passion and dedication and commitment. And especially when you have some lived experience and can really empathize and familiarize with the folks that you're serving, it really helps create that sustainability and keeping going and going forward with the work, because we know it can be tiring.
Sure.
So thank you so much for all of your service. Yes. And I'm sure that there's many babies that you shepherd into this world.
Yes.
People are really interested in alternative approaches when bringing their babies into the world. So what is a doula?
So, first of all, before you can become a doula, you have to do the childbirth education. So I am a childbirth educator first, where we took a training and you get all the information needed about the anatomy and all what birth is all about and all of this. I became a trained doula in 2019. My trainer was Lorenzo Hall, who is one of the persons who started the doula program in Massachusetts to begin. And she started out in Cambridge, Mass. When I found out that they were going to do this doula program in the city of Boston, which is something I always felt was needed, but was not affordable because, folks paid from their pockets. There was no coverage under doula work at the time. So I decided, yes, this is what I want. Midwife, doula, that kind of thing, that rang a bell in the back of my head. So I decided I would take the training. And a doula is really a support or trained non-clinical, emotional, physical support person who is in the room present while the birth person is giving birth. We support prior to them going. We meet up with the client, find out what type of birth they want, whether it's assisted birth, which means they want to have an epidural or some kind of meds, whether they would like to have a cesarean birth, and whether they want to have a bath-in birth, and what sort of treatment they would like should anything happen or not happen. Our job is to provide hands-on comfort measures So what that means is anything that will make that client comfortable during the birthing, whether it's soft music, turning off the lights, putting on some fake candles because you know you can't have real candles in there, playing whatever type of music they want, of course. It could be soft, it could be whatever they're into. Afrobeats, whatever they would like, and to have positive communication between the persons in the room, which is the nurses, the obstetrician, maybe a midwife, because lots of times during birth, it's so hectic for the patient. They're in pain, or they think they're in pain, or they might be very calm, you never know, but they can't understand the medical lingo. So the nurse might, or the obstetricianist or the assistant might be saying something to them, and at that particular time it sounds so medically informed that they would like it to be broken down so they could understand. And a lot of times there's no time to explain that in the room during the birth. So what we try to do is meet with the client, try to give them a little insight of various things they may need or want or hear, and try to have them as comfortable as possible by giving them the answers to the questions. Another thing, we're not at the bottom, meaning that we're in the ear of at the top of the bed, in the client's ear, listening to what they're asking for. Trying to keep them as calm as possible.
So really that nurturing support.
Really nurturing support. You have to be into it. I believe if you're a loving person or if you're a people's person, that is something that will make the client even very, very, very comfortable during that time. Yeah.
And almost like a conduit, so you're able to kind of bridge that medicalness with that nurturing support in case there are questions or things that come up.
Yeah.